So going back to PERI, which stands for Problem, Etiology, Recommendations, Implementation, and Evaluation. Reviewing the P, the problem, we looked at incident rates and we looked at um, uh, prevalence rates, incidence and prevalence, mortality rates to help define the problem in health for a certain population. Etiology, which is the E, are all of the different types of data collection that we just reviewed. The observational studies along with the randomized controlled studies. So now let's look at recommendation. Once we have the information on the differences in rate, the contributory causes, those sorts of things, we can start to make recommendations. So recommendations must also be evaluated. So we need to look at the magnitude of the impact and the quality of evidence. So what that means is how the magnitude of impact is how far-reaching is the impact. Is it just a small group or can you scale it up to a large population? And then the quality of evidence about that. I'll be honest, in health education, a lot of times they just use a pre and post test for measuring, quote unquote, learning. So you'll have a health educator come in and they'll give you a pre-test on the topic that they're about to talk about. They'll then give the lesson and then have you do the same test as a post-test. Now, there are some that would argue that is not truly high quality of evidence in terms of the evaluation, because learning really has to do with if you remember it in the future. So actually a better assessment, evaluation of learning would be if that health educator came back in maybe 3 or 4 weeks and gave you the post-test to see what you really remembered, what you actually learned. So those are things that will be part of your recommendation is the point, is how are you going to evaluate? And then also interventions can be scored and graded and utilized based on the best fit. So you will find when we go to Healthy People 2020 that there are different scores and ratings on the different interventions depending upon these different characteristics of the population. Again, an intervention that works with college students possibly won't work with senior citizens. So we definitely need to be aware and concerned with the population that we're serving. So that's the R of PERI. So let's go and look at the I. I is implementation. So with implementation, we're looking at to whom should we target? Who are these interventions intended for? And then we need to look at the timing. All right, so for example, flu shots. In terms of implementation, we give flu shots in the fall because that's prior to when we have cold and flu season. A lot of times colleges will do spring break events to help students make healthier choices with regards to what they do over spring break. All right, so implementation, it's who are we going to target, when are we going to target them, and then how are you going to target them? Is it going to be a program? What kind of intervention? Will it be media-based, a large event, what? So that's implementation. Now, with regards to implementation, we need to cover the different levels of prevention. There are 3 levels: primary, secondary, and tertiary. So primary intervention is intended to prevent injury or disease. So when you have a primary prevention, you're trying to keep people from getting the disease. So you have people that don't have the disease, and I want to keep you from getting the disease. A secondary intervention is intended to minimize the risk of the disease or complications. So generally, secondary interventions would be interventions aimed at people that are at high risk for developing the disease, but they're still asymptomatic, meaning that they don't have symptoms of the disease. They probably have early development of the disease, and we're trying to minimize damage from that disease. That's a secondary intervention. Tertiary is when someone has the disease and we're trying to manage or minimize the disability that's caused by that disease. So looking at these in a graph form, you have primary, secondary, and tertiary. So in terms of the population's disease status, Primary, the people are susceptible, but they don't have the disease, and we're trying to reduce the disease incidence. With secondary, they have early stages, but they're still asymptomatic, so we're trying to reduce the prevalence of something becoming full-blown and trying to reduce the consequences of the disease. Tertiary, the person is symptomatic, they have the diagnosis, and we're trying to reduce complications and disabilities that result from having that disease. So when we look at implementation based on the 3 levels, primary, prior to the disease, we look at who are we going to target and how are we going to target them. So oftentimes with primary prevention, it's after you identify the who, usually it's giving them information or resources to participate in behaviors that reduce risk. Secondary, we're looking at at-risk groups, so maybe seniors in terms of diabetes or heart disease. And then we're looking at motivations and incentives. So how can we motivate them to make healthy choices so that they don't continue to develop a disease. And then tertiary, it's more about reversing, prior to irreversible complications is when, and we're looking at the general population or the community. And again, we're looking at how we can get them to participate. So, question, condoms, are these primary, secondary, or tertiary prevention? Here's another one. Screening tests. This is a throat culture probably, or some kind of a culture, but we'll just say it's a screening test. Is that primary, secondary, or tertiary? Lab tests. What type of intervention would this be? If I do a blood test to find out if you're pre-diabetic, do a blood sugar. Primary, secondary, or tertiary? Medication. So this one is related to HIV positive and preventing people from becoming HIV positive, or treating it, I should say, not preventing. So this is an HIV antiviral, and it can treat HIV infection and reduce the risk of HIV. It doesn't cure HIV or AIDS, but combinations of drugs that treat HIV infection may slow the disease progress and prolong life. So this is for people that have HIV. Primary, secondary, or tertiary?